In this video, I'll talk about eating disorders, thinking about key characteristics of three eating disorders, thinking about what are some of the health consequences from those eating disorders, talk briefly about what leads to eating disorders, the female athlete triad, and then thinking about treatment and resources that are here on BYU campus for any of those who might be interested. The first one we're going to talk about is anorexia nervosa. So with anorexia nervosa, intake tends to be quite low and restricted, and that's going to happen over a certain period of time, and there will be other kind of manifestations that can come through either in physical ways or emotional ways, depending on how long the eating disorder or anorexia nervosa has been going on, and thinking about what those consequences might be. There can be a distorted body image, thinking that they are larger than what they really are, and thinking that they can't be low enough. And again, that they're restricting food intake to an extreme level. So here are some of the physical consequences. So without not having adequate amount of calories around, things in the body are just not going to function as well. So we're going to see there's going to be some loss of fat pad so subcutaneous fat, which helps to maintain body temperature. So that's going to be affected. We're going to see potential loss of menstruation, and we're going to see what's called lanugo, which is this downy-like hair covering on the skin. When you don't have enough calories around, you're going to start having some bone loss. You're going to have muscle mass loss, probably not going to be getting enough iron and other micronutrients in the diet. So that can really lead to those consequences we've talked about related to thinking about iron, having fatigue, potential fainting without adequate protein, again, and that can lead to hair loss, lower bone mass, again, a muscle tissue. So all of these effects we can see can have some real serious negative physical impacts on the body. And thinking about the heart is a muscle as well. So as we lose, as a person would lose that muscle tissue, the heart may malfunction as well. So you can have irregular heartbeat. You could have some kind of iron deficiency anemia. You can see some other issues here related to the restriction of calories. On the emotional social side, some of the things I've already mentioned, so fear of gaining weight, having distorted body image. What's interesting is even though they're restricting calories, their thought process about food is much greater. So they're preoccupied with food, but they're not eating. So they know probably they probably even know better than I do what kind of calories are in the foods that they're eating, and are very focused on that and heightened awareness of food in that situation. Social interest may decline, because if you think about it, social settings often include food, and if they're restricting, then they may not want to have to explain themselves in that situation, or may choose to socialize when there's not food around, or make excuses for why they're not eating. Maybe they say that they've already eaten. One of these things, we do see some mental health concerns that are correlated with anorexia nervosa, including depression. So that can increase as well. Bulimia nervosa is the second eating disorder that I'll talk about in this video. So bulimia nervosa is a cycle of different types of emotions and behaviors. So you can see that it can start with binging. So it could be binge eating, and that means consuming a large amount of food in a certain period of time. And part of that is because of having this, once they've binged, then they have this fear that they're going to gain weight, and so they can do some kind of compensatory behavior to be able to get rid of the food, or to account for that high calorie they just consumed. So in this figure in your book is showing purging, and that definitely is true. Vomiting or purging is a compensatory behavior. However, there are other ones that are considered compensatory behaviors that are not just vomiting. So the use of laxatives after, again, having this binge, and then using laxatives as a way to compensate for the concern about fear of weight gain. Use of diuretics, enema, over-exercising, and your book talks a little bit more about what that looks like. how they might define that. So you can take a look at that there, or using fasting as a way to compensate. And then this compensatory behavior then can lead to this thought of that they're have a loss of fear of fat gain, but they can lead to feelings of guilt, shame, and this can lead to anxiety, and this can start the cycle again. Some of the consequences that come from bulimia nervosa, there are physical and emotional consequences. So with physical, you can see some of the same things we talked about before with anorexia nervosa. These are now for differing reasons of why we're seeing this, because some of those compensatory behaviors like vomiting or even use of laxatives, you can see imbalances in some of the electrolytes. You might start seeing dental decay if they're vomiting because of the acid coming up and eroding the teeth, and the enamel on the teeth can lead to dental caries. And you can also see swollen salivary glands. The irritation of the esophagus, this is related to, again, if they're vomiting, it can lead to the acid erosion of the tissue in the esophagus. It doesn't have that nice lining or coating of mucus that the stomach has to protect the stomach from the hydrochloric acid that's present when we consume food. So that hydrochloric acid going in the esophagus actually can lead to damage to that tissue. And so you'd have irritation there. It can lead to stomach ulcer. Emotional things can include, we mentioned before, shame and guilt. It also has been associated with bulimia nervosa, has also been associated with anxiety and depression. The next eating disorder is binge eating disorder. So this one is one in which a person would consume a large amount of food, maybe even not kind of in an uncontrollable manner, and not doing any kind of compensatory behavior. So again, consuming a large amount of food without doing a compensatory behavior. So what are some of the physical effects with this? Well, because of the large amount of food that's being consumed, there may be potential here for weight gain. So in this case, we might see obesity, and so then you would have any of the health complications that comes with obesity, including hypertension, high cholesterol, fatty liver disease. You can see atherosclerosis leading to heart disease, type 2 diabetes. So you can see lots of things here that can be related to binge eating disorder. Emotional, some of the similar things we've seen before, so feelings of shame and guilt, association with depression or other types of mental health disorders. The female athlete triad is something that is that was identified in, and you can imagine, in athletes, and you really can see these consequences really in anyone who might be engaging in this type of behavior. So low energy availability is what we're looking at here. So in this case, we might see that we have an athlete who's expending a lot of energy through physical activity and other things that their expenditure through physical activity, and then thinking about that they're not compensating their calorie levels sufficiently to maintain function of their body. And so low energy availability really means that the energy need that's needed for the energy demand that's needed for exercise or physical activity is not available from what's being consumed in the diet. So in this case, what we can see is this low energy availability can lead to amenorrhea, or lack of menstrual periods. Now, of course, this is in females, right? We're thinking about female athletes. And this lack of menstrual periods, or amenorrhea, can be related to low estrogen levels, and we know that estrogen helps to maintain bone. So what can happen and then of course, if they're not getting enough nutrients in their diet to help maintain bone and tissue. So we've got estrogen. So essentially double things are happening here. You've got low estrogen levels, and you also have low nutrient intake. This is going to lead again to amenorrhea because low estrogen levels, and then we're going to see that this leads then to bone loss. And in this case, we can see osteoporosis in a much younger person than what we would expect. Typically, we see osteoporosis manifested in older individuals, but when we see it in a young athlete, then we might be concerned about them not getting enough energy in their diet, enough calories in their diet. And if it's paired and we see they have amenorrhea and osteoporosis, this is probably indicative of female athlete triad. So you can imagine that with bone loss, we're also going to be demineralizing our bones, so losing calcium as well. So this is a really big concern that we want to make sure that we want to make sure that this is caught early, and that we can help these female athletes be able to maintain their health and still perform in their as an athlete as they would desire to do. What leads to eating disorders? There are a lot of different factors that can lead to eating disorders. Some of the things I'm going to mention are just things that we found through research. And I will make a note here, because I haven't said it yet, that eating disorders can happen both in men and women. It happens more often in women, but it doesn't mean it doesn't happen in men. So both are at risk for the negative consequences that could come through engaging in an eating disorder. So here's some contributing causes, a summary slide. So it could be maybe it's health and fitness is taken to the extreme. So it could start out healthy, but then go to an extreme level of things that are not as healthy, and to the point that it's leading to an eating disorder. Maybe it started out as a diet, but now it's gone again to extreme, and now this extreme dieting has led to an eating disorder. Maybe there's pressures or certain expectations. Maybe there's abuse from others. All of those things have been associated with eating disorders. Modeling parents' behavior, we do know from research how important it is, that relationship between the parents and their children. And especially, we see that mothers who have had previous eating disorders are more likely to have daughters who have that as well, and thinking about that modeling of their behavior. So I think it's so important. Some of you are going to be parents someday, and maybe some of you are parents now, how important it is that we focus on people's true worth and internally, and the wonderful characteristics and qualities they have, and focus less on their anything about their body, and thinking about we want to exercise and eat healthy for our health, not to reach a certain body size. Sometimes there's personal characteristics like perfectionism that can lead to potential to eating disorders. Genetics, this is a newer one that we found, that there is a genetic component that they found that can be related to risk as a risk factor for eating disorders. In your book, they have this activity called Rate Your Plate that's at the end of the chapter. And I encourage you to look through this if you just to think about yourself and maybe friends that you have who you might be concerned about that they might have an eating disorder. So this is what's called a 5-question screening tool, the SCOFF questionnaire. And you can read through these questions and seeing whether or not, after you've read through these, thinking about whether or not you might have an eating disorder. And on here, if you have 2 or more positive responses, it suggests maybe an eating disorder. Now you have to remember, this isn't a true diagnostic tool, it's just a screening tool. So maybe there's a risk for that. Maybe there is a risk for an eating disorder. It doesn't mean it's absolutely you have one. But if you do, so you might feel you have one or potential to develop one, or maybe you feel like a friend of yours might have an eating disorder. And these things, if you do feel this way, I'm going to give you some resources here locally that you can actually use in order to think about how might you approach this situation. So the questions here are, what counseling education resources exist in your area? And I'm going to talk about that in the next couple of slides. And then, what do you think is the best way to assist a friend who might have an eating disorder? How would it best be to help them? So first I want to let you know about the women's services here this is CAP services here. So counseling, psychological services. So this is open to anyone for any kind of psychological counseling. And I think what's important to recognize is sometimes with eating disorders, people want to intervene with people they care about by talking about food or their need for food or changing their behavior with food. And really what we know is that eating disorders have a psychological underpinning, meaning what I mean by that is that usually when we talk about treatment of eating disorders, it's talking about psychological treatment. Usually these are the stem of or you have to think about what is the stem or the contributing cause to the eating disorder being manifested, and really treating that underlying contributing cause to the eating disorder is really critical. And that usually is from a psychological perspective. Eating disorders really isn't necessarily about the food. It's about what's triggering that person to respond to food in the way that they do. So we want to treat the psychological underpinning of that's contributing to the eating disorder being manifested. And of course, they're going to have dietitians who are helping the person who has an eating disorder with nutrition and helping them to normalize eating behaviors. But you definitely cannot work without a psychiatrist or psychologist in that process as well. At BYU, we have a great service for students. This is free. It's counseling and psychological services. And if you feel that you're in a situation of emergency, they will take you right in. And in other cases, they will offer you an opportunity to schedule an appointment with one of the counselors. You can see that they have individual counseling, they have group therapy. There's a lot of different services that they offer. Here's where they're located in the Wilkinson Center. You can just walk in, or you can give them a call, either way. Now the next slide is where we get into women's services. So this is another resource that's available on campus. You can see it's also in the Wilkinson Center. There's a phone number and there's also an email. You can look at their website as well. Now, even though this focuses, the name seems like it only focuses on women, they really are open to anyone coming, men or women who might be interested, any student on campus who might be interested in getting services can contact them. So those are two great resources that are available here on campus. If you're not on campus, there are websites looking at national eating disorders. That's posted on Canvas as well. And what I would say is if you want to help someone who you believe has an eating disorder, it's important first to reassure them that you are there to support them, that you recognize their great worth, that you don't focus on trying to help them with eating, but that you encourage them to get help, that you have concerns from what you're seeing and you encourage them to get help. And if they're open to that, you can even offer to go with them if they would feel more comfortable with that the first time that they go. If they feel like they need someone there as a support, you could do that. And that's really all you can do. Whether or not they choose to get help is up to them. But you can be there to support them no matter what. And I know that sometimes that can be really hard to see a loved one not recognize that maybe there's a concern there or not want to get help. But you have to respect their agency and just continue to be a support and to continue to let them know that you're always there for them. And maybe at some point they would be interested in getting help if they feel it's a concern for them. And again, you can just be that support system for them. So if you have further questions about this section, feel free to talk to me or to the TAs.